Okay, good afternoon, everybody, and welcome. Thank you for joining us today for this webinar dedicated to the SOS Spotlight on Sjogren study. My name is Keti Antonopoulou. I'm the Communications Head of Agora Federation, and I will be moderating today's sessions. This webinar is designed as a conversation rather than a series of presentations. We will focus on questions and answers, both among our panelists and from you, the audiences. This OS study provides real-world insights directly from people living with Sjogren disease, highlighting not only physical symptoms, but also emotional burden, daily functioning, unmet needs, and treatment expectations. Although this study focuses on people living with Sjogren disease, many of its findings clearly resonate far beyond Sjogren's. As we will see today, the burden described, fatigue, pain, emotional impact, impaired quality of life, and unmet treatment needs is strikingly similar across many rheumatic and autoimmune diseases. At that sense, this study does not only speak for Sjogren's patients, but reflects the lived experience of people with rheumatic diseases more broadly. Our goal today is to explore what these findings really mean for patients, for clinical practice, and for the future of care and research. You are welcome to submit your questions at any point during the webinar, and we will address as many as possible during the discussion. Please note that write your questions to the Q&A button and not to the chat in order to have and to facilitate the panelists. Thank you very much. Just to begin, I would like to present our panelist, which is Professor Andreas Voules, which is the professor of rheumatology in Laiko Hospital in Greece, an expert center. Igor Medojevic, which is is a caregiver of Sjogren's patients and member of the board of Agora Federation. And last but not least, Coralie Bouillot, which is a Sjogren patient, and of course, it's a PRP expert and a patient Sjogren. So thank you very much, all our panelists on that. And just to begin, I would like to ask our panelists, what did you see as the most striking or important message coming out of the SOS study?
Okay, shall I start?
Ladies first.
Okay, thank you, Andreas. The most important thing from my perspective as a patient out of this kind of study is the awareness that kind of study gives about burden in Sjogren's patients, because everybody knows how invisible the disease is, how heterogeneous the disease is. And it's always super difficult to let people know how we feel inside. And this disease is really not well recognized by the medical community, except the great clinician with whom we are working to raise awareness about Sjogren's. But I mean, patients often say that their GP or maybe some rheumatologist doesn't know the disease. So that kind of study, of survey highlights, and it's very important, the burden for the patient from my perspective.
Thank you, Coralie. What about you, Andreas, and then Igor?
Igor can start.
Igor?
Please, Igor.
I think that the professor was that. Okay. I listening very carefully, Coralie, and like patients, I can say only that last 2 years I realized what is Sjogren, because my primary is rheumatic disease is arthritis, and I think that is everything in the first of all, not now. Everything is the same, but is not. I learning a lot about Sjogren still, and the best in my country I must say it is very important that people know what is Sjogren, and what is the send the messages for all of them. That is not so easy. And I realize with my wife, like caregiver, what is exactly Sjogren, and I have a lot of work here in Montenegro to people realize what is Sjogren, with lot of questionnaires, with lot of things that is with helping to understand and to fighting with this disease.
Igor, can I ask you something? As a sorry, as a caregiver, does that kind of study is important for you to understand maybe the burden of the disease for your wife? And do you think that it could help also other caregivers to understand better what it is? What do you think? Do you think that it can help? I mean, I'm thinking of maybe, because you're a caregiver, but sometimes we don't have many caregivers to listen and to share their experience. So if you think that it could be great, maybe we could also disseminate among caregivers if you think it can be helpful.
Yes, it is very important to understand these caregivers, but it is also important is the support to family. Family must understand. First of all, for everything as go from the house. Is you have a sport in the house, caregiver is only one of the line, and another, and then the space when you're working in your work also must understand you, because we are not allowed to work all shift 8 hours or something, and people, because we are looking so good sometimes, and people think that nothing is everything okay with him, and this is very also important to understand.
Okay. I think that this specific study sent us three main messages and three main points. The first point is that the disease affects many different levels of life among patients, and unfortunately adversely. The personal life is affected, the emotion is affected, quality of life, work, everything, every part and every field of patients' life is affected. That's the first message. The second message is that the treatments we offer to our patients is definitely not enough. And the third message is that we, the scientific community, should pay more attention to what patients say. So these are I think the three messages. Sjogren is a difficult disease. Unfortunately, it's not only the involvement of organs and tissues. We should not compartmentalize patients, but we should see patients as a whole. And it seems that the most important aspects of a human life is affected by the disease. It's the first message. The second message, as I said, is that treatments are not enough, and we should not treat what we believe as clinicians. Unfortunately, the Sjogren's is complicated by lymphoma and etc. But the majority of patients suffer from these issues. And as I said, the third is that we should listen more to patients. And I think it's a very good step that in the past 2 years we have introduced in clinical trials the double population strategy, trying to respond to the patients' reported outcomes, which reflect what patients need. So three major points, simple points, but easy to understand, but difficult to address. This is from my perception.
Okay, thank you very much. And before of that, may I share the leaflet of the spotlight? Sorry, but it's my mistake, just to see our audiences and attendees what is about. Of course, we have sent them to everybody, the spotlight, in order to read and be prepared on our webinar, but just a reminder. And secondly, as we have written in the chat, we have live captions in multiple languages. So if everybody wants to have the webinar in the all local language, please find it. You will find captions, you will see your languages, and you will hear all the webinar and all the panelists in your languages. Thank you very much on that. And let me share now my screen. You see my screen?
Yep.
Okay. Do you see the spotlight?
Yes.
Yes.
Okay. This is the spotlight on Sjogren's. And of course, this is from Novartis, and we also thank Novartis. Thank Novartis in order to be that sponsor in that webinar, because it's very important for us to show and to inform the patients. And again, not only Sjogren's patients, but all rheumatic patients, because their and the barriers are the same for all, similar the same for all. So you will see this is the study. We have already showed to you and sent it to you. You see that it is 1,155 adults, aged more than 80 years. And this is the partnership. Unfortunately, was not partner to that study with Novartis. We will hope that in their next study we will be involved, and we will discuss that with Novartis. You will see that the results, which is among people living with Sjogren's, more than 9 out of 10 experience at least one other systematic manifestation in addition to dryness. That means that that Sjogren is not dryness or not only. You see that the priorities and perceived physiology are not always aligned. That is not only happening, that is not only with Sjogren, but all the disease. We have different perspectives than the HCPs. So you see what's written like that. Again, please see the leaflet we have sent you, or we can send it to you after the webinar, because or it is uploaded in our webinar, in our Agora website. And the most of important treatment goals for Sjogren therapy is patients' most important goals, patients perceive persistence most important goals. And this is the leaflet. I'm going to close my share screen, because we would like to have to stop sharing. We would like to have our panelists to see them and to discuss with them. Please send your questions again to Q&A. And for starting, I would like to, understanding the burden, we see that the study clearly shows that Sjogren is much more than dryness. How do your findings of that study change or reinforce our understanding of the real burden of Sjogren disease? Were there any findings that surprised you, particularly regarding fatigue, emotional impact, or daily functioning? Can we start first of all from our patient Coralie, then goes to the caregiver, Igor, and then to our professional Andreas?
Well, thank you, Katie. I'm not surprised at all. I'm not surprised at all, because we as patients, we know since ages that Sjogren, it's not only dryness. And we worked on it as an international group to change the name of the disease from syndrome to disease. And that will help battle the idea of the dryness disease, because that has been really harmful for patients. because many patients still today are reporting that their GP said, okay, you have to put drops in your eyes and you will be okay. So what is really super helpful in this survey, in this study, is that 9 patients out of 10, if I read correctly, experience and have said that they have experienced at least one systemic manifestation in addition to dryness. So again, I speak again about awareness, and it's very important to see that on 1,200 patients, 9 out of 10 are declaring having a systemic manifestation that will help patient community to prove and prove and prove again, and to help people understand that it's not only dryness. So that's really my first findings. And the second one will be the patient reporting having emotional issues. 58% of patients reported a high impact on emotional well-being. And that is something really crucial in addressing Sjogren unmet needs, because it shows that 1% out of 2 declare that this disease have an impact on their mental health. And that's absolutely, it's really important to have data like that to be able to help the patients, because it's a so difficult disease. And we say it, and I will say it all the evening. This is so difficult to deal with that we patients, we need to be accompanied, we need to be supported on mental well-being and mental health. That was my 2 main findings in the figures that you show, Cathy, because again, I think it's a huge step for the community, the scientific community, the caregivers, the family community, to really understand what this disease really means from the inside. And I have a question for Andreas, Cathy, if you allow me, Professor Goules. Have you noticed since the latest years a better education amongst your patients about Sjogren's? I was curious to know if you see that patients are more and more educated on the disease, or if they are more and more, if you noticed an evolution with your patients. I mean, I was curious to know that, because we are doing a lot of education, communication, and so I wanted to know if your patients started maybe to better know their disease, better manage their disease. I was curious about that.
Okay, let Igor make the comment, and I will answer to Coralie. I will give the question just to pass the microphone to Igor first.
Okay. I listening very carefully, Coralie, what he's talking about, because I still learning, and it is big surprise for me. I said before, because dry illness, it is for me something new, because I learning from my wife what is the dry mouth, dry eyes, dry example. I just similar little things I said, because I cannot understand in first moment what is the dry mouth, and you need special toothpaste. For me, it's something, because in rheumatic arthritis you don't have these things. And also you mentioned the emotion. Emotion is a big problem, for my opinion, because it's a big problem. Because first of all, when I meet she, it is first thing that is she don't realize that people understand she, because what is a passing sometimes is very difficult, sometimes easy. It's very difficult to say after you, because you said all these things what I thinking, and no, really, this is my opinion.
Okay, so regarding the first comment by Katie, I'm not surprised from the findings of the study. If you work with Sjogren disease patients, you know that they have a huge problem, as I said previously, in every level. I think that all patients know that Sjogren disease is not an exocrine disease, it's a systemic disease. They know it, the majority of them, and they have the perception that apart from dryness, they also experience other problems, connoting the systemic nature of the disease. So I'm not surprised by any finding, but it's good to record such findings because patients are getting more and more aware, and clinicians also. So I think it's a very useful effort, especially published in a scientific journal. Every clinician should see the findings of this study, and the best way is to be published in a scientific journal. We need to reinforce the communication between clinicians and patients. I believe that some rheumatologists who do not see patients with Sjogren, but they are, let's say, they are familiar with other rheumatic diseases like lupus or rheumatoid arthritis. It is a good opportunity to focus a little bit in Sjogren because the other diseases are more focused to tissue damage, and in this way the rheumatologist loses the holistic picture of Sjogren, which may accompany other systemic autoimmune diseases. So I think it's very important that this specific study is published in a scientific journal. Regarding Coralie's question, yes, I truly believe that in the past 2-3 years, patients are more familiar with the disease, are better educated. They are more interested for webinars, for any kind of information. I think it is, let's say, a hope for them to be able to communicate with other patients, to share the common experience and the common feelings, bad feelings, unfortunately. And yes, I think you are doing an excellent work, and many patients of our cohort participate. They want to know. They are more aware, more educated in the past 2-3 years regarding Sjogren. So I think that these webinars, these kind of studies, what you organized in Cyprus, what you organized in Athens, I think it's very important because patients need this. It is like a hook for them to come together with other patients and to come together with us, the clinicians.
Thank you for your kind words. I'd like something else that I would like to say regarding this the survey results. One of a problem for me as a patient, normal patients, let's say, I feel that this disease finally is neglected because fortunately it is not serious we know the vast majority of cases, and again, fortunately it is not serious. Toda's disease is often neglected or dismissed. And I know that other patients feel the same. You know, the GP said, oh, Sjogren, stop. And patients are really sad about that because they have the feeling that the medical community don't take their symptoms and their burden seriously. And that's something else that we can show in the survey. And the patient just want their quality of life back at the end. Of course, they are concerned about the disease worsening, but we know, again, fortunately, that in many cases, the disease won't be serious for the organs, serious damage and everything. But what is important again to say is that this disease should not be neglected anymore, because it shows in the study that many patients feel that they are in a bad health, let's say. So that's something else I wanted to highlight because I feel it's important to communicate about this. And if we pay attention to the patient priority, they don't even talk about their symptoms. They do, but it's not in the top three. Of course, they do, and the first symptoms they are mentioning is fatigue for all of us. But they are talking about, they are worried about the disease worsening. So we also need to communicate a lot and to have a lot of information about the potential complication of Sjogren's. We all know about lymphoma and so, but patient needs to know that. The overall symptom and the top three is the quality of life. So it was something I wanted to highlight as well. Yes.
If I
Yes.
add something, if we see that a significant proportion of participants reported a high emotional impact, as Coralie said, including frustration, anxiety, and feelings of helplessness. And I think, and we also have a question about that, and this is why I would like to ask again. Why do you think the emotional impact of Sjogren and rheumatic diseases in general is still so underestimated? It's a very tricky question, and it's about you, Andreas.
Yes, okay. That's why I said previously that it is important that this survey, this study is published in a scientific journal. RMD is a well-recognized journal in rheumatology, so the clinicians and rheumatologists will take a look in this survey, independently if they work with Sjogren disease or not. Do not forget that 10-15% of patients with lupus or scleroderma, they also have rheumatoid arthritis or scleroderma, they also have Sjogren. So it is a very good effort that this survey is published in a scientific journal. This will attract the attention of clinicians and rheumatologists who are not paying so much attention in Sjogren. Regarding Katie's question about the emotional burden, yeah, I think this is a general characteristic of all rheumatic diseases because patients with rheumatic diseases, they have a chronic problem, either pain or fatigue or dryness. So I think the chronicity interacts with their personality. Pain and fatigue all day and for prolonged periods affect somehow the quality of life, and this cumulatively has an impact on the emotion of patients with rheumatic diseases. So they develop depression, anxiety, because the emotional burden and the impact is translated in let's say entities like anxiety and depression. So the exposure to chronicity, disability, a significant reduction in quality of life, they act cumulatively, and finally they affect the emotion of patients with rheumatic diseases. It's the chronicity and the prolonged disturbance of quality of life that leads to this high proportion of emotional burden, not only Sjogren, but in almost every rheumatic disease. This is my explanation.
Yeah, if I may. Yes, thank you. I think it's quite complete. I would like just to add something as a woman, as a mother. I would like to add at what you said, Andreas, about disability and so on. I will add loss of productivity in every single domain, because this disease affects all the domain of your life. And you know how it is as a mother, as a spouse, as someone, a worker or whatever, this disease reduce your loss of productivity. So you have some stress and you feel guilty. You feel guilty because maybe you can't work 100% anymore, and you can't cook as you were cooking before, and you can't go with the kids all day, running, walking, whatever it can be. And all this amount of small things that the disease steals from you, that the disease prevents you to do, all these are creating, of course, frustration, of course, stress, of course, sadness, but also guilt. And that contributes to be, in a difficult emotional state, or to have issues with your mental health, because as you said, the chronicity of the disease, when it's every day, every week, every month, every year, and you just can't do it. And that's really, really difficult to accept, the fact that you are diminished. I don't know how to say in English, but you are not as powerful as you were before. So you have to accept the disease, you have to accept your new life, you have to grieve your ex-life, and it's all a process. So honestly, I would recommend to all the patients to, if they can, at some times, maybe be supported by a professional in mental health, just to help with a couple of steps that can be difficult to deal with.
Thank you, Coralie. And now I just have another question about that from our attendee. How can this be better addressed in everyday care? I really don't know how to answer to that. And please, I would like to have your opinion as a patient, Igor's opinion as caregiver, and of course, Andrea's opinion as HCPs. How can this be better addressed in everyday care about emotional impact? I mean,
No, it's on emotional impact only. Well,
yes.
honestly, what I think is that never hesitate to ask a professional of mental health, just see a psychologist. I mean, it's just normal. We can't go through the diagnosis. For many patients, the errance of diagnosis and the long-term delay before their diagnosis. So you get through waiting for your diagnosis, the exams, everything. And finally, you get in that chronicity, that chronic disease, without any treatment, without any, to date, anything to give you the hope to get better. Maybe you have to stop working, you have to stop doing what you like to do. So it's really the first advice. Don't hesitate to ask and see a psychologist to help you. I mean, I think the better care would be that one for the patient. And the second one would be, as we said many times, a better knowledge for all the doctors community, because the rheumatologist will probably know the disease, but the first doctor will be the GP. And maybe sometimes some rheumatologists are not really totally up to date about Sjogren, so and so on. So, I mean, the better care for me is to be supported by a psychologist in the first place.
Okay.
Igor?
My opinion, I understand Coralie because he's patient. Like caregiver, I all the time give support and courage. All the time. You can do it. Go. Don't think about that. We can finish it. But I'm tired. No, because I all the time support and push. This is important because I struggling all the time with arthritis, and all the time I never want to show my my bad things, you know, because also I have two daughters. If you are pity, you're done. It's important that you have the support even for them. This is circles, and all the time we must support all of, my opinion, and all the time struggling. Some my opinion.
Yeah. So in clinical practice, it is very difficult to handle and manage this emotional burden. I think that there are two steps to try to address this issue. The first is to educate your patients and offer them the possibility to discuss and talk about their concerns. And during this conversation, you should offer always the possibility to be supported by a psychologist and or a medication if necessary. So the first is to have a good relationship with your patients, discuss the options, and be aware that some of our patients do not discuss this issue because they are afraid, because they feel guilt. So you need to approach them and, let's say, smell that something is going wrong with your patient. If you see, for instance, changes in mood, this is an alarm sign for the clinician. So you always build a very good relationship. You always educate your patient. You always offer them the opportunity to talk, and you always offer them the opportunity to be referred to a psychologist for psychotherapy or even medication. Some patients are afraid of medication. I'm talking about medication for anxiety or medication for depression. This is also a task of the clinician to discuss the possibility to introduce in the treatment of Sjogren medications for anxiety or depression. So the good relationship with your patient, the discussion about these issues, and the possibility to offer a referral to a psychologist are main points to try, at least in part, to handle this emotional burden that Sjogren and other rheumatic diseases have upon patients.
Thank you very much, Andreas. And we have another question that says, Mrs. Bonia asks, why there is a low level of awareness about the burden in Sjogren disease? I think that we're making a lot of awareness the last 5 years. Still, I'm speaking about the Sjogren Federation. I think that Coralie is going to agree with me, but still has to do a lot of it because new things are being always finding out, new findings. So we'll continue improve the awareness, we continue to inform the patients, but we'll continue learning new things. And don't forget that until the very last years, Sjogren disease and Sjogren disease is a rare disease. So it is underdiagnosed, the physicians and the HCPs, I think that it does not give them any so much attention. Sorry, Andreas, for that. I'm not sure if I'm using the right words. And only when we start working with Sjogren Federation back to 2019, we're just trying to advocate, and we have all our communications and relations with the experts all over Europe and with other associations and foundations like Sjogren Foundation. We're trying to force and to start having a better awareness about Sjogren disease. And this is my opinion as not as head of communication of Agora, as president of Sjogren. So I think that, yes, you are right, but it's not as low as you say. It goes very well, and we have a lot of awareness the last years. Please agree or not agree with me. I would like to hear from our panelists.
Yeah, Katia, I totally agree with you. I think that when you look back, the interest in Sjogren's disease is finally quite recent. I mean, not for a core group of rheumatologists who are working on it since maybe 10 or 15 years, and we know, but I think there's since, let's say, 5, 8, maybe 10 years, some findings to explain that it was a systemic disease. And once it has been admitted that it was a systemic disease, many research project has been started, many research has been led, and so on. So I think it's normal to take time in that kind of poorly known disease, misunderstood, and for which we don't know exactly, but I won't talk instead of Andreas, but we don't know exactly what is concretely the pathogenesis of the disease. So I guess it that all those things have been contributed to this low awareness of the disease.
Thank you, Coralie. Do you have any other two panelists to say
I
something?
I think the question is why the community and clinicians are not aware of the emotional burden. That's the question, correct? That's what I got.
No, I think it's about all the awareness about Sjogren disease. They said that it is low awareness about Sjogren disease. Why it's so low awareness?
Okay, sorry, I think the question was about the emotional burden. Anyway,
No, it's in general.
there are two reasons, I think. The first is because Sjogren is a rare disease and very often accompanies other systemic autoimmune diseases, and so the GPs, the internists, do not know the disease well. And the second is that the majority of patients, they have dryness symptoms, Zika symptoms, which evolve slowly, and they do not talk to their GP or to their family physician or to their internist so early. So there is a gap in the scientific community and in the general population because before you go to your physician, your general population, even if you suffer from Sjogren.
Yes.
So there is a gap of education within the medical community and the scientific community, and there's also a gap in the general population. If we manage to fill this gap, then the patients will be diagnosed earlier, and the awareness will diminish, definitely.
Thank you, Andreas. And it is another point out that Sjogren, that SOS study shows is that the difference of patient priorities versus clinical focus. I think that they have one of our attendees asks, how important is this misalignment between patients' priorities and perceived medical priorities? And what are the real life consequences for patient-physician communications? How can this gap realistically be bridged in clinical practice? It is another question about clinical practice and clinical focus and patients' priorities. What do you have to answer on that? And please, I would like to have the opinion of the three of you.
It's a very good question. It's a very good question. We know that in every disease, when the patient and the physician perception are misaligned, there's a problem in communication. We know that in every disease, in every clinical practice. In this particular study, what I would like to say is that when we see that, by example, the patient most important goal, which will be, as we said at the beginning, the preventing the worsening of the disease and the improvement of overall symptoms. So globally, improvement of quality of life and overall symptoms. That's the patient most important goal. The patient perceived physician most important goals are quite different. My findings will be, it will be probably a normal gap. Andreas, we will have some patient with Sjogren's disease that he wants to treat, maybe if there's organ involvement complication. But the patient wants its quality of life to be improved. Though there's misalignment. The physician has to treat the patient, but fatigue and global of bad quality of life in Sjogren's, we don't have anything to treat. So there's normal to have a misalignment between patients. If I was Andreas Goulet's patient, I would come, please do something on my fatigue. Please, I can't bear it anymore. And what will he say? I will check your lung, I will check your kidney, I will check you don't have any lymphoma. Sorry, but for your fatigue, I can't do anything. Okay, there's a huge misalignment, but because that's it. I mean, we can't do. I mean, I don't know, Andreas, what you will reply, but we can't do anything else. I guess that in this study, the physicians say that the patient's priority is probably maybe not having complication, okay? Because he's thinking as a physician. But me as a patient, I will say, please just improve my quality of life. I can't bear it anymore. So there's what I think about that misalignment. I mean, and I'm sure that it's the same thing in many diseases. So how can we overlap this gap? I don't know. Doctors are to treat, and patients have expectation that doctors can't reply all the time. I mean, I don't know how to honestly to address that gap. Maybe by again collaboration, education, and communication.
Yeah. Igor, you want to talk?
I agree with Coralie, everything, believe me, because when I want to say the same things. No, go ahead. Thank you.
Yeah. So if you go to this specific study in figure 3, I think Coralie mentioned that, you will see patient-reported and patient-perceived healthcare professionals' most important treatment goals. This figure is the most important figure of this specific study and survey. It says everything in a simple way. Why patients are concerned, preventing the worsening of my Sjogren. This is a general concern. Improvement in overall symptoms. It means that, okay, my physician does not treat my symptoms. This is the translation. Improving my quality of life. Because you do not treat my symptoms, my quality of life is bad. So they're somehow related. But this is the core. This is the meaning of this study. Figure 3 for the participants. Personally, I think that the symptoms in Sjogren have also a psychological element and an organic element, but we don't know the pathogenesis yet. Okay. Somehow the neurotransmitters, the cytokines, all these are changing, and patients feel fatigue. Patients feel pain, but not the typical pain of rheumatoid arthritis, etc. So it is the dark side of the moon, the symptoms in Sjogren, because we don't know the pathogenesis of the disease, especially if it is so complex as we hypothesize, and especially if it is so chronic. So everything changes in patients' systems, but unfortunately, we are now, as physicians and clinicians, start listening to patients' complaints, but unfortunately, we cannot treat fatigue. We cannot treat dryness effectively because we miss many parts of the puzzle regarding pathogenesis. It is good that we try to communicate better and try to bridge this miscommunication, because as Coralie said, we will check out the systems and okay, that's it. Now we are trying to hear more patient's voice, but still this is not enough. I cannot treat the fatigue of a patient because I don't know how to do it now. We hope as we study more the pathogenesis or some parts of pathogenesis, we will be able to be more effective. But it is an issue. All these webinars, all these symposium we are doing, I think they are improving our communication with patients, but still this is not enough. We miss important parts of the puzzle because as Coralie said, she will come to my office, I will check her, but she will still have fatigue. She will still have impairment in productivity. She will still have impaired overall activity, and finally bad quality of life. It is an issue. There is the dark side of the moon that is still missing. We are trying. We should try together. I think the communication is improved, is much improved between clinicians and patients, but still there are gaps in pathogenesis to fill. And we hope that as we are learning the disease better and better, we will be able at some point to alleviate these symptoms like fatigue. But I think we are still far, unfortunately. But we hope.
Thank you, Andreas. And now we have another question very close to what they were already said. One of our colleagues writes, do you see any improvement on the understanding of Sjogren symptoms other than dry eyes and dry mouth among other physicians? How is information sharing being managed?
I'm sorry, Katie, can you repeat the question because I had some interruptions?
Yes. Did you see an improvement of the understanding of Sjogren symptoms other than dry eyes and dry mouth among other physicians? For example, how is information sharing being managed? I think that our colleague asked from your expert, as you as an expert, from experts, how the information about the other symptoms than dry mouth and dry eyes can be shared to other physicians in order to be informed and in order to early see all the other symptoms. This is actually the question, I think.
Yeah. One of the most devastating symptoms of Sjogren is fatigue. Maybe it's the worst by far, even worse than dryness. So the pathogenesis of fatigue is very, very dark, even in other diseases. This is a feeling, meaning that it has to do with the structures of brain, it has to do with the structures of spinal cord, it has to do with the deep structures of the central nervous system. We don't know much in terms of pathogenesis. We have some clues from other diseases like fibromyalgia. Things are very complex in diseases such as fibromyalgia. So even if we get some information and some insights from other diseases, still the pathogenesis of fatigue and other symptoms than dryness is still dark. And this is why we cannot effectively handle fatigue or the general feeling of pain, which is, as I said, different from the joint pain, the typical joint pain in rheumatoid arthritis. These are, let's say, very complex feelings. Many different structures, as I said previously, are involved. And the pathogenesis, even from other similar diseases, is still poor and dark. That's why we cannot, as I said, effectively handle and treat these symptoms that appear in patients with Sjogren. We hope, though, that as we go deeper and deeper with the omics technologies or with the attempts to somehow associate symptoms with specific biological and molecular pathways, we may finally, at some point, we may finally be able to give some answers and to finalize some associations from which we may be able to design some modern treatments.
Thank you, Andreas. And I just see that what is particularly striking is that these findings of that SOS study are not specific for Sjogren alone. In fact, I believe that this closely mirror what we constantly hear from patients across the entire rheumatic disease spectrum. This is why we told from the beginning that it's not only about Sjogren. I think that all that invisible burden like fatigue, pain, emotional distress, and the gap between patients' priorities and clinical focus are common themes about rheumatic diseases. And this is very important because I think that what do you believe? How can real world evidence like the SO study be translated into meaningful change, whether it's the clinical practice, research priorities, or health policy? This is very important for us because we have the SO studies, we have the findings, but how can this be translated into meaningful change for patients like rheumatic patients, not only Sjogren's?
If I may start, Katy, what I think is what we talked earlier with Igor about family, caregivers, and even work and doctors. Honestly, my GP didn't know quite anything about Sjogren when I've been diagnosed. Okay? If at that time I would be comfortable enough to give him that leaflet, by example, by saying, "Oh, doctor, please, do you want to have a look?" Just something really simple. It's probably, honestly, I think it's probably could have improved my management by my GP, first of all. Second, for my family, my husband, or anyone close to me, if I had a support like that 10 years ago when I've been diagnosed, maybe it could have started to talk with my relatives or whatever by saying, you see, blah blah, and how many patients are super fatigue or they have a bad quality of life. I think it's something that can really help patients to talk about that disease. Again, invisible, heterogeneous. Sometimes you don't feel confident enough to talk about yourself. So I think that can be changed something for the patient to give that leaflet to start a discussion, honestly.
Thank you, Coralie. Igor, Andreas?
Look, many, as I said, many clinicians and physicians and rheumatologists will be able to study this survey and become familiar with Sjogren. That's the first point. The second point is that in everyday clinical practice, as we discussed previously, fatigue, for instance, is a very common symptom among different rheumatic diseases and among fibromyalgia. Very often, because I cannot give a specific treatment for fatigue, I push my patients to the specialists for fibromyalgia who have an holistic approach with psychotherapy, as we said previously, with exercise, with some medications. So studies like this can, let's say, fertilize physician mind to try to find some solutions, even if we don't have, as I said previously, specific treatments for fatigue. For instance, I'm personally, as I said, if I see a Sjogren disease patient with fatigue, exhausting fatigue, affecting very adversely the quality of life, I discuss with a colleague who is a specialist in fibromyalgia, and he is or she is, let's say, introduced into the fibromyalgia, let's say, modalities, as I said, with exercise, with specific medications, etc. So the more we are exposed as physicians to such survey, the more our mind will try to find solutions in order to serve your patients. I don't see any other way at this point how this survey could further help patients in clinical practice, but such studies will also sensitize the pharmaceutical companies to focus a little bit more in patients' reported outcomes. For instance, I think that the two population strategy is at least in part a result of such surveys of patients' intervention. So the pharmaceutical companies and the clinical trials try to switch the one-way strategy only with the SSDI, for instance. And in this way, ESS-PRI came in the two population strategy. So even if we don't have a clear benefit in everyday clinical practice, there is an indirect benefit through the pharmaceutical companies. Everybody pushes from different sides for a solution, for the solutions for patients. So even if the benefits are not very visible at this point, I think it is important to have such studies and such surveys.
I totally agree with you, and I have two comments from our colleagues. One is from Italy, Maria Silvia Tonolo, and it says that the issues faced by patients with Sjogren's are handled differently from region to region. Some can receive home care, others financial benefits to purchase specific foods, but the problem of proper medical follow-up and support is really serious. This is from Italy. And we have another from Maria Petru who said it is a great disappointment to hear that it's too far to find the pathogenesis of Sjogren disease, as patients with Sjogren disease, lupus, and Hashimoto, struggling to manage a house, a job in front of PC for 8 hours and for 8 and more hours, feeling need only dry eyes, but like you cannot see anymore. But you can't tell anyone because you are losing your job, and so on. So this is two comments, one from Italy and I think one from Greece, and really see what this is the real world right now. And as I can't have, and as we came to the end of today's, because I saw that it's 10 minutes past 8, I would like to thank all our panelists for this thoughtful and honest discussions. One key message I'd like to leave you with is that the findings of the SOS study are not unique to Sjogren disease. What patients described here at that study is the invisible burden, fatigue, emotional impact, and unmet needs, a reality shared by people living with rheumatic diseases as a whole. This reinforces a broader and urgent message: patient-centered care, early recognition, and addressing the systematic and emotional impact of disease must be central to how we design care, research, and policy. Listening to the patient's voice is not optional, it is essential. I would like to thank you on behalf of the organizers. Thank you to everyone who joined us today, and especially to the patients whose experiences made this study possible. Of course, I would like to thank again our panelists, Coralie Willow, Igor Bedoyevich, and Andreas Goules, and last but not least, our sponsor Novartis, who has also has this study organized and has sponsored our welcome. And thank you all of you for your engagement. I think we should leave right now here, and thank you all of you, and see you very soon to our next webinar. Thank you.
Thank you.
Bye.
Thank you. Bye-bye. Bye-bye.